the citation of the theme speaker for today's event. I don't have it's beyond my payroll to do such a thing. So I will invite Dr. Martha Anieto. Keep up the red card on this. Please put your hands together for her.
Ladies and gentlemen, today we are privileged to have as our theme speaker a consultant psychiatrist, Federal Medical Center Umuahia. He is a fellow of the National Postgraduate Medical College of Nigeria, Faculty of Psychiatry, and currently an MD candidate of the college. He is an expert, particularly among health workers, with experience in delivering similar presentations in the private sector. He is a published author in local and international journals. He holds an MBA with distinction from Mexico University and a postgraduate diploma in humanitarian assistance from the Liverpool School of Tropical Medicine in the UK. He actively participates in local and international conferences, sharing insights on mental health and healthcare delivery. He is happily married with children, enjoys reading and socializing with friends during his leisure time. Ladies and gentlemen, with a standing ovation, can we please welcome to the podium Dr. Usman Kasim Abimbola.
Thank you very much. Let me start with the existing protocol. I'm happy to be in the midst of friends. 2 years ago, I was also here to present burnout syndromes among health workers. This is indeed a mental health friendly place. And the medical director has been supporting us. So what I'm talking about today, I've done this several times, but it's just mental health workers in the private sector. But today, I'm talking about mental health workers in healthcare work. This is a very important topic, because you can hear the medical director as when you look at this environment now, you will even say that it was Umuahia I came 2 years ago. Things have really changed. Even my own world has been expanded. We even need more beds now to at least we have a lot of patients. And I believe that even if the accreditation panel comes now, we'll be able to get this partial accreditation. So thank you, sir, for always being there. Today, when I'm doing this kind of presentation, I always just don't define mental health until one day when I discovered that most of who I was talking to, they didn't even know what is mental health. They tend to mix mental health to mental illness and mental health problems. So I'm going to start by telling us what mental health is. Mental health is a state where individuals can cope with normal stress of life, realizes his or her potential, work productively, and contribute meaningfully to his community. So we have what I mentioned 4 cardinal things. That is, cope with normal stress of life, realizes your potential, work productively, because the major thing is we are talking about work. And that means you can't work productively without mental health. And realize and at least contribute meaningfully to the community. It's when you have good mental health, all these 4, they are not the same in terms of weight. The first is more weightier than the second, and the third, and the fourth. The first is cope with normal stresses of life. What is normal stress of life? are the things, because you can't become anything without facing stresses. We must face stress, we must face challenges to be able to get to wherever we want to get in life. Coping is the resources that we have that is in us, that we use to face challenges at any point in time. But thank God, doctors have more coping resources from even the studies and all the things I've done than most other workers. Probably because of the inoculation from medical school. But at the same time, the coping resource can be overwhelmed. And when it is overwhelmed, then the person develops mental health problems. Have you not noticed a time when you discover that you are just tired, you don't know what is making you to be tired? You even think maybe it's malaria, you go and do malaria test, you don't see anything. You just not interested in the work. Every average doctor must have compassion for his patient. Every average doctor must have empathy for his patient. When you are born out, you lose those things. You will no longer have compassion for the patient. You will no longer have empathy for the patient. And the problem, even yourself, you will lose interest in yourself. And you will blame yourself, why did I study medicine? Unfortunately, there are a lot of burnout in the medical sector. About 50% of medical workers have burnout syndrome. About 30% have symptoms of anxiety or depression. I am not saying depressive disorder. I am not saying anxiety disorder. Mental health problem is not the same thing as mental illness. The coping that we are saying that can be overwhelmed and cause problem for us is not necessarily making us to have schizophrenia. It's not necessarily making us to have bipolar. It is going to cause us to have anxiety symptoms, not anxiety disorder. Depressive symptoms, not depressive disorder. Those who go on to develop mental illness are those who have already been predisposed. The genetics load the gun, and then the stress pull the trigger. But everybody can have burnout syndrome. Everybody can have anxiety symptoms or depression. Everybody in the health sector can have moral injury. Number one, long working hours. We work longer than most other workers. Even in health sectors as doctors, we work longer because sometimes some people have the opportunity of working and then getting a weeknight off. You'll be on call, and you continue the other day, and then you still go home. So all those long working hours is a very big stressor for us, which can make us to develop mental health problems and mental illness in those who are already predisposed. Emotional demands. Every day we see things, sufferings, death. You are managing somebody, you have done your best, you have given all your best, and you discover that the person died. It's going to affect you too. It's going to affect your emotion because your aim is that your efforts to bring a better outcome. Now the person is dead. The person may be so important. How do you break news to the person that, okay, your only son is dead? There is a lot of demand on our coping resources because of that emotional demand. Then we have resource constraints. When I say resource constraints, I mean manpower constraints, equipment constraints. One person will be doing work of about 10 people, if not more. That can be overwhelming to our coping resources, and it can make us to break down and come with that burnout syndrome, anxiety. Then equipment. Imagine a situation, you see a patient, you have the wherewithal to help that patient, and the patient, you could not do it because you don't have equipment. It will cause what we call moral injury, and that's a mental health problem. So when we are talking about, unfortunately, has left us, it should not be about only we have houses, we have buildings, there are so many things we need to have that can address the mental health problems of workers. Then workplace challenges. Before, even it has happened to me before, when the patient relative came to attack me in emergency because their person died. So we have a lot of challenges that if you are even around at night, you cannot even guarantee that you cannot just come in. No security, no police post, nothing whatsoever. You are just walking in fear. All those things can cause mental health problems. So, what is the impact of mental health problems on patient care? It decreases quality of care. When you are worn out, you cannot pour from the empty vessels. You are tired. Your energy level is gone. You can't give anything. So, there will be decreased quality of care. And it might compromise patient safety. Because have you not seen a situation whereby you want to write paracetamol, you write morphine because you are born out, and that can affect the safety of the patient. Even increase healthcare costs, because this is the work that needs you to be able to make the right diagnosis. To be able, you may get it wrong when you are not mentally stable. And then that will make the patient to stay longer, leading to increased cost of care. Apart from that, when you begin to have problems, you don't know it's malaria, you don't know it's this, and you need to move from one place to the other, sometimes you are absent. And then there will be problem with continuity. If it's in the private sector, they have to get a local doctor to replace you. That's another way of having adding cost to the healthcare cost. Then start turnover and continue to issue. That's not what I'm talking about. There can be absenteeism, that is, you are absent because of mental health challenges, which you think is another thing. You sometimes you are even present because of our presenteeism. You are present, but you are not working. So we call that one presenteeism. So it's as good as even your senior lecturer can say, it's not better for you to go instead of just staying here. You are not participating. So all these things can happen when somebody has mental health problem. So, but the problem is that let us first of all identify the barrier before we now begin to talk about how do we address mental health issues of healthcare workers. The first thing is stigma and fear of treatment. The first thing is that you hardly can see people, they hardly want to, I've seen a lot of people in the outpatient department that will come and meet me. It's not that they have bipolar, it's not that they have whatever. It can even be marriage issues. It can be so many things. Maybe they are working, the husband is giving them problem at home, they are no longer able to maintain focus any longer. They come a lot, but they will still tell you we don't want our name to enter here because of stigma. So that is one barrier, fear of judgment. That even in the past there was a place where they retrained people for even having contact with mental health experts. So the fear of judgment, the fear of okay, they will say one day maybe they want to retrain people and may be sufficient because of mental health issues. Workload and time constraint. Imagine if you look at yourself, at times you don't even have the time for your doctors prioritize their patient care more than their own. Even when I was now reading this physician secret or oath now, I was that particular aspect struck me that did doctor actually take care of themselves. Some doctors here now don't know their blood pressure. And they will be measuring the blood pressure of somebody every day. Now, you now have to be quiet and you now say you should go for a counseling somewhere. The counseling will wait forever. So, that is a constraint, a barrier for addressing mental health problem. Lack of mental health resources. There should be an easily available mental health service in terms of manpower and in terms of even the equipment. Your health workers, since we to have a clinic that is staff clinic. Why is there no component of mental health in that clinic for those who have issues with their mental health? Even if we can't do that, what about having a place they can call at any point in time? Because I have given lectures in Chevron, whatever, they have all these things in place. They have employees assistance programs where the employee can call at any time. Some may be having issue at home, they may be having issue with their husband, their spouse, or anything whatsoever. They call. There is a psychology there 24 hours. And if the matter is beyond what the psychologists can handle, they will refer to psychiatrists. And then you can even generate revenue from there because all these EA those oil companies usually contract it out. We don't have such thing in most of the government healthcare environment. And that is not so having access to the problem, somebody to even talk to at the time you are having the problem is an issue. Even when you are having the issue, your senior will be telling you that you are lazy. He is somebody that has been working. He has been working, has been doing everything. He was not like that. Today, he started having that problem. You say he's lazy. Because they don't know that he's having a problem. That's why they will say, you are lazy, go and do the work. And he has even changed now. It was not like that before. Maybe it's not like that before. Is that not telling you that something is wrong? So those are the issue. Well, another thing is that cultural and organization barriers. In some cultures, discussing mental health is believed to be a spiritual matter. So, and it's not something that they believe that is a medical issue that you engage the doctor to talk about. Some feel that once I even associate myself with that psychologist who mind, once you get psychiatric, that's another problem. So they may not want to come and address their mental health. Lack of training and awareness. Most times, people that are very supervisors, they should have adequate training to identify common mental health problems. So that when they see the signal, they will quickly refer that person to the appropriate quarters. But even most people that have mental health issues, if not because of some of advocacy, I will go somewhere and talk about some issues, because some they don't believe that okay, mental health is schizophrenia, bipolar disorder, this and that. All those disorders, they are not, they are about 10% of what are mental health issues. But they just say, well, no, my problem is psychiatric. I'm not going to go there. So those are the barriers. Now, having known the barrier, we can have we know the solution already. The solution is going to be in two ways. Because usually some people want to begin to solve the problem of the healthcare workers. No. It is once there is a mental health issues in an organization. In fact, in the private sector, what we use as a yardstick to measure whether that organization, whether it prioritizes mental health or not, is that we just assess the level of burnout. Once the burnout is much, that organization does not prioritize mental health. Burnout is an important outcome that we use to assess whether an organization prioritizes mental health or not. Because so many people may be sitting down here, that does not mean they are not burnout. There are a lot of people with burnout syndrome. Once you see that it is more, that means there is a problem with the mental health policy in that organization. And then we do some intervention and sometimes we get better outcome. Because human resources is very, very more important than any other resource you can have. And once the human resources is sick, that is the end, even productivity, everything, even the profit I want to make, you will not be able to make it. So the first thing is that there must be organizational culture that prioritizes mental health. Like the medical director has been, even there was a time he was telling them maybe they can go something to screen people, maybe when people are coming, screen and see who they need, whatever. Mental health problems are not what you look out for by screening. You can train people around. Once they identify, oh, this one, even may the fact that John has been very hardworking. He has been up and doing. Suddenly, joy is just maybe He's not meeting deadline again. He's not doing what he was doing again. That is an indication that there is a problem in job at that point in time. That is a signal that they should send Joel for a counselor, where we will identify what is even the problem the John is causing. That is making him to do the things before. Because when we say normal and abnormal, the important thing is that what is normal is in relation to you. What you are doing before, and you are not doing it again, that's what makes you abnormal. If what you are doing before, if you are always slapping everybody, and that is you. So that does not mean that you are normal. But you are normal when you change from what you were before. So the organization should provide a culture that we encourage open discussion as we are talking. Because talking about things reduces stigmatization. Then the organization should implement policies that protect confidentiality and support those who need help. Because some people don't want to talk because if I talk, they will use it against me. So there should be a policy that guarantees the confidentiality, even if nobody comes out to talk. Then another thing that to do is to provide accessible mental health resources. So establish on-site mental health services and support programs tailored specially for healthcare workers. That's what I was saying the other time. That it's not that healthcare workers will now come to psychiatric department. There should be a special, or like we have staff clinic, there should be a mental health section there, where you and it's not doesn't have to be a psychiatrist there. But most of these problems we are talking about can be handled by psychologists. So you will be there, and then anytime the person has problem, and then you also make sure maybe a factual like employee assistance program, where even someone that doesn't want to come and doesn't have the time can call him at any time and say this is the problem, and the problem can be addressed on home. Then we should encourage self-care practices and create opportunity for breaks and time off. Because self-care is about, like this hospital now, there should be gym where people can come in the morning, exercise themselves first or whatever, and have a changing room. There should be competitions, maybe O&G versus surgery and so many other activities like that, recreative activities that at least there should be a good lunch where people can go watch football and all the rest. Those are self-care activities, and then they should be encouraged to eat well and have adequate sleep. If somebody has been denied for 24 hours sleep, they also deserve another 24 hours of rest to recuperate. So all those things must be in place, and then overtraining and education. We provide training for healthcare workers to know what is even mental health issue, like what we are doing now, and then maybe do it, maybe organize workshop, stress management, and so that people can know how to take care of themselves. They can know when they should take break from work. They should know when they want to walk around. They should know what to do, what step do I take, this is happening to me. So they should know all those things through training. Then we should reduce workload and improve work-life balance. But this person that is here also has a husband, some have concubine, whatever. Some has the work-life balance. A work must not take your other life. The other life must also encourage and approach in your work. So there must be work-life balance. You must be able to, like, nothing stops the hospital from having a crèche. The nursing mother can put their children there and occasionally go there to take care of, give express breast milk and all that, give them the breast milk and whatever. That should be a crèche. There can be schools for those who are interested, that is at least a little bit affordable and this thing. So that all those things that stress people, I want to go and carry my child, I want to go and do whatever, those are also additional stress. They are not directly related to being working as a healthcare worker, but they are part of what you need to do. Which go together. So work balance, the workload, there should be flexible options to do the work. Even if there's a work that can be done online, it should be done not as if you have to be here till 8 o'clock, 4 o'clock. There should be flexibility. And the workload should be individualized depending on the individual. So this one is about Okay, solution. Then the leadership should also support all these initiatives, because without the support of the leadership, it cannot work. The leadership must prioritize mental health as part of organization policy. Be a policy that this is a policy of this organization, and it must be done. There must be clear protocols on how to manage mental health issues in the hospital, for the healthcare workers in the hospital. Then there can be creation, can create peer support. Those who have mental health issues can have WhatsApp group or whatever, where people can exchange ideas. And when I was having what the problem you had, this is what I did and all the rest. So continue. So the role of leadership here is that leaders also should give an example. The leaders should also make sure that if they have any issues with mental health, they should be able to come out and talk about it. They should be able to encourage discussion. They should not hide their own and expect the followers to, because a leader should be a coach and a mentor. So, and they should create a supportive work environment where everybody feels supported and nobody feels stigmatized. Then resources to do all these things also should be allocated by the leaders. Then provide easy access. So training and education, even the leaders themselves should go for training so that they can quickly know a member of the team that is having the problem and take those to an appropriate place. So the leaders should be equipped with skills to support employees effectively and intervene upon when needed. Then they should promote the peer support system, encourage development of peer support networks. Leaders should actively participate and endorse the initiative. Then they should advocate for mental health policies, even at their level, because the way we run Nigeria, the FMC is not independent of the federal government. Even at their level, they should advocate so that there can be increase in the budget for so as to take care of the healthcare workers. Then there should be leaders should encourage reporting, and then whoever that has problems, there should be follow-up to know how the person is faring. So all these things we are talking about, why do we need to address it? We all know. If we address the mental health of workers, we have improved job performance and productivity. And we have enhanced patient health outcomes. Enhanced patient outcomes, reduction in staff turnover, lower healthcare costs, positive organization reputation, compliance with legal and ethical standards, because there won't be errors, so there won't be errors, and the reputation of the hospital will be. I just want to quickly talk about, this is not something new, hospitals have done it. And then we have about hospitals that have prioritized mental health in their establishment. And this is the outcome in major clinic in whatever. When they assess the outcome, there was reduced burnout rates, there was improved job satisfaction, enhanced patient care quality, and reduced turnover. Also, another hospital, National Health Service, they also introduced interfere with the mental health issues of their workers. And then is the impact. It increases mental health awareness among the staff, improves staff morale, reduces absenteeism, and then culture of openness and support around mental health. So in conclusion, the well-being of healthcare workers is the foundation of effective patient care. So as healthcare delivery, prioritizing mental health creates resilient, compassionate, and efficient healthcare team. Investing in support system for healthcare workers is not an option, it is a necessity. Together we can build a healthier, more sustainable healthcare environment for all. So thank you for listening.
Thank you, sir, for this beautiful lecture. And I want to believe that learned a lot. So we're going to be taking one or two questions for the speaker. If we have questions for him, so that we can take the questions before he goes to sit down. If you have a question, please raise your hand.
Thank you so much. Thank you for the wonderful lecture you gave me. It's very timely with our time. What I want to ask is, what are the things on ground? Is there any report mechanism, any notification mechanism for any doctor. Like you said, many of us, somebody said, look by your side. You can't form one of them is actually having some mental health issue. Is there any report or support mechanism that we have in the hospital now where if you see that your colleague is actually having a mental breakdown or getting depressed or whatever reason, having mental issues, or he himself can just go and actually report, and then the hospital can now take it up and look for ways of calming it down. Not enough to actually know the theoretical part of it. What do we have to do now? Thank you.
I'm waiting for another question.
A wonderful question. Yeah. Today I understood difference between mental illness and the mental health, and there are two different entities. And my question is, when you mention about the stressors, using myself as an example, I think most of those stressors can affect me, and I believe most of the workers and the residents are also affected. So is there a way that the department is having an arrangement or interaction in ways so that the rest of these factors, because prior to now, this current constitution, some of those things have been there, and with what is happening in the country now, I think if it was 20% before, the percentage by now would have increased to either 30 or even more than that. So is there any active engagement so that we can reduce some of these stressors to avoid the impact of this entire Thank you.
You asked about whether there is any process. There is no process yet. The people just come by themselves. If they have any issues, and tell you this is what I have, what can you do? But this is the process. Even in the colloquium, they always put, because every problem starts from discussion. The problem what you don't discuss about, is not, but when you start discussing problems, then, and we are going to, even the medical director who has been asking us on so many areas, I think maybe has not gotten the proper advice. But we are going to press on to have a protocol in place for any health workers that has issue, but there is none as of now. You talk about the stressor that most of these things, that you have the stressor does not mean you have a mental health problem. Maybe it's somebody that has been fascinated. If all your life you have been used to stressor, but that does not mean that if you continue to be exposed, there will be a time, just like elasticity, that we will get to a point where the person will break down. So that is also what we're talking about here, that we should address those stressors. I think he also mentioned that a lot of resident doctors are coming. I wonder if they come, they will still not go. So, because this is what they have been having, somebody will come and somebody will go. So, I don't know how, but there is always an attempt to attend to but with all what we have discussed now, we also make representation to the medical directors on what can be done. At least we should start to do something. So that even from this feedback, from this conversation, we'll get to him to do something for us so that at the end of the day, at least we start from somewhere and then we continue to develop. And we have hospitals in another line that can copy how they solve their problem. So we don't need to even pass our brain. We just copy what they have done. So thank you so much I'm very grateful. All right.
All right, thank you very much, sir. Please put your hands together for him once again. Yeah. Okay,